Assalamu alaikum. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Pushundhara Addin Medical College. Today I am going to discuss about important topic, epilepsy and anti-epileptic drug. Before going to drug, I am going to discuss about epilepsy. What is epilepsy or what is the definition of epilepsy? Epilepsy is a heterogeneous symptom complex of a chronic disorder that is characterized by recurrent seizure. It is the second common neurological disorder after stroke. Now, what is seizure? Seizure is a clinical symptoms and signs caused by abnormal electrical discharge within the cerebral cortex, or seizure are finite episode of brain dysfunction resulting from abnormal discharge of the cerebral neurons. What are the types of seizures? Seizures are broadly classified into two types. Number one, generalized seizure, and number two, partial or focal seizure. Generalized seizure are of classified generalized tonic-clonic seizure, absent seizure, tonic seizure, clonic seizure, myoclonic seizure, and infantile spasm. And partial or focal seizure, it is another classified by simple partial seizure, complex partial seizure, and partial seizure secondarily generalized. What are the etiology or what are the causes of seizure? Number one, genetic or early developmental cause, that is sodium channel mutation and cerebral palsy. Number two, structural or metabolic cause, that is brain tumor, traumatic head injury, hypoglycemia, meningeal infection, stroke, rapid withdrawal of the alcohol from chronic alcoholics. And number three, and very important cause, is unknown cause. Now, I am going to tell about the anti-epileptic drugs. What are anti-epileptic drugs? Anti-epileptic drugs are classified into three categories. Number one, voltage-sensitive sodium channel blocker, carbamazepine, oxcarbazepine, phenytoin, phosphenitoin, lamotrigine. Number two, T-type calcium channel blocker, ethosuximide, gabapentin, pregabalin. And number three, GABA potentiator, valproic acid, barbiturates, benzodiazepine, and vigabatrin. Now, firstly, I am going to tell about the carbamazepine in short, how carbamazepine acts. It blocks sodium channel, or it blocks voltage sensitive sodium channel and inhibit the generation of repetitive action potential in the epileptic focus and prevent their spread. What are the uses or what are the clinical conditions where we use carbamazepine? Generalized tonic-clonic seizure, partial seizure, trigeminal neuralgia, and bipolar disorder for controlling mania are the important indication of carbamazepine. What are the adverse effects of carbamazepine? Vertigo, drowsiness, dizziness, diplopia, ataxia, GIT upset, depressed AV conduction, idiosyncratic reaction, erythematous skin rash, Stevens-Johnson syndrome, lupus-like syndrome, hepatitis, agranulocytosis, aplastic anemia, leukopenia, water retention, hyponatremia, fetal malformation, falling of blood pressure, that is hypotension, and cardiac arrhythmia are their important adverse effects. Now, phenytoin. I am going to tell about phenytoin in short, how phenytoin acts. Phenytoin acts by altering the sodium and calcium conductance. At therapeutic concentration, the major action of phenytoin is to block high-frequency repetitive firing of the action potential by blocking the persistent sodium current in the epileptic focus. Reduction of the sodium permeability with inhibition of the calcium influx across the cell membrane and inhibit a variety of calcium-induced secretory process including release of hormone and excitatory neurotransmitter. Phenytoin decrease the synaptic release of the glutamate and enhance the release of the inhibitory neurotransmitter GABA. What are their indications? Indications are generalized tonic-clonic seizure, simple and partial, complex partial seizure, status epilepticus, trigeminal neuralgia, and cardiac arrhythmia. What are the adverse effects of phenytoin? At high plasma level, it depresses the cerebellar and vestibular system and causes ataxia, vertigo, diplopia, nystagmus, drowsiness and cognitive impairment, and in case of chronic use or prolonged use, it may cause gum hypertrophy, hirsutism, coarsening of the facial feature, increased folate metabolism, increased vitamin D metabolism, megaloblastic anemia, osteoporosis, osteomalacia and fetal hydantoin syndrome. Now, the very important drug valproic acid, how it acts. It acts by blocking the high frequency repetitive firing of the action potential by blocking the persistent sodium current and blockage of the NMDA receptor mediated excitation. It increases the level of GABA in brain by facilitating the glutamic acid decarboxylase, the enzyme that is responsible for the GABA synthesis, and inhibitory effects on GABA transporter, that is GAT1. At high level of concentration, valproate inhibit the GABA transaminase in brain and blocking the degradation of the GABA. What are the indications of valproic acid? Valproic acid are used in absent seizure, partial seizure, myoclonic seizure, tonic-clonic seizure, atonic seizure, occasionally in case of status epilepticus, bipolar disorder and migraine prophylaxis. What are their adverse effects? GIT complaints, in most common nausea, vomiting, abdominal pain, heartburn, etc. And rarely it may cause weight gain, increased appetite and hair loss. Now, what is status epilepticus? When the seizure activity occurs for more than 30 minutes or 2 or more seizures occur without recovery of the consciousness, then the condition is considered as a status epilepticus. Recurrent tonic-clonic convulsion without recovery of the consciousness in between is a life-threatening emergency condition. What is the management? Immediate cardiovascular, respiratory and metabolic management is required as early as possible. Diazepam IV route, lorazepam IV route, fosphenytoin, phenytoin, phenobarbital are the drug of choice in case of status epilepticus. Now, absent seizure. It is also called petit mal. The onset generally occur in the 3 to 5 years of age and last until puberty or beyond. The drug therapy. Ethosuximide and valproic acid are equally effective or equally efficacious in case of absent seizure. But another drugs may used like lamotrigine, clonazepam, clobazam, etc. Now, febrile convulsion. Some children, especially under 5 years, develop the convulsion during their episode of high fever and seizure may recur every time with fever. What is the management? Temperature should not be allowed to rise. Paracetamol may given through oral route and external cooling. The best treatment of the febrile convulsion is rectal diazepam. 0.5 mg per kg body weight is the drug of choice. Thank you everyone. That's all for today.